Stand by SOT1.
Standing.
10 seconds. Ready, rolling. Ready, SOT1.
Ready.
In 4, 3, 2, 1. Roll in.
From legendary Uncle Studios in beautiful Southern California, welcome to another edition of Work Comp Matters, the central location for you employees, you employers, and of course, we haven't forgotten about you damn independent contractors. And now, here's this week's edition of Work Comp Matters.
It is January 10th, 12 noon straight up. Welcome to another edition of Work Comp Matters. We are, of course, brought to you by mancavepodcasting.com. If you want to do your own podcast where all you have to do anywhere in the world is talk, all you need is a smartphone or a computer, we will go ahead and produce, manage, direct, get that sucker streamed live and in the cloud forever. Also, if you just want to listen, we have over 600 shows in the tank. They are at your disposal 24/7. They're completely free, no obligation. Good afternoon, everybody. My name's Steve Appel. I'm, of course, joined by the madman across the water, Mr. Jan Scalia. Much thanks to Scott from legendary Uncle Studios. And I have an announcement. I've told you all before that I joined a new firm, Nitka Algazi. I just hired my assistant manager, and I am so happy. I want to introduce her to everybody. Her name is Beatrice Reyes, but we just call her B. Say hello, B.
Hi, nice to meet you all.
And I hope B is excited to be learning the field of workers' compensation. She has no experience working for a law firm, but 10 years of experience working for a bank. And clearly, I am the least knowledgeable about banking. So she is going to complement our work here. And I'm so proud to have her with us. Say goodbye, everybody, B.
Goodbye, everybody.
But B's going to be listening right now. Anyways, it's a pleasure to be with you all. Welcome to another edition of Work Comp Matters. And we, of course, have California current events that affect you employees, you employers. And of course, we haven't forgotten about you independent contractors. Stories in the news today from the Los Angeles Times. Los Angeles County sets a new daily record with over 45,000 coronavirus cases. From Cal Matters, California weighs order canceling elective surgeries as COVID surges. From the Modesto Bee, COVID leads Turlock to close city offices at least for 2 weeks. From San Francisco, got COVID and live in California? A guide to the confusing isolation guidelines. From the San Francisco Chronicle, also up north, medicine meets emotion. COVID expert shares what's happening when his son tested positive. From Orange County Register, OC Congresswoman Young Kim tests positive for COVID-19. I think also there's a story that OAC tested positive for COVID. But continuing on, from the Sacramento Bee, too many 911 calls in COVID surge, San Francisco says, and additional stories for you employees, employers, and independent contractor. But now I'm going to go to my trusted partner, the 45-year workers' compensation, employment, and labor law attorney in Munich, Germany, Mr. Jan Scalia. Go ahead, John.
Okay, this story says California weighs order canceling elective surgeries as COVID surges. In Los Angeles, a severely ill patient has to wait for a new lung after his transplant scheduled for last Friday was canceled. In San Diego, brain surgery to ease the chronic pain of a 7-year-old girl was called off last week. In Arcadia, as many as 60 patients will likely have their surgeries canceled this week. In Folsom, at least 11 operations already were scrapped last week. And at one hospital in Anaheim, a patient waited on a gurney for back surgery for 3 hours before he was sent home because of lack of staff. Throughout California, as COVID-19 infections deplete their staff of nurses, anesthesiologists, and other essential workers, Hospitals are canceling or postponing so-called elective, that's in quotes, surgeries to repair injured knees and aching back, remove kidney or bladder stones, and repair cataracts or hernias, among other procedures. Alarmed by a growing shortage of specialized healthcare workers, the Cal Department of Public Health is evaluating whether to issue an order to hospitals statewide to suspend elective surgeries in cases in which patients wouldn't be immediately harmed. Now, I have two observations about this because during a doctor's strike a while back, I think it was a doctor's strike, not maybe a nurse's strike anyway, hospital staff strike, two things happen when elective surgeries get canceled. One, interestingly enough, the death rate goes down. Interesting, huh? Secondly, hospital profits go way down. Yeah, they make a lot of money on these so-called elective surgeries. So it'll be interesting to see if there's any pushback from the hospitals on this, prospective order from the administration, and whether or not they might take it to court. Steve.
Yeah, John, I think last year, when it came to healthcare workers, I think just about everybody did go on strike or threaten to strike, except the doctors. But that being said, here's our next story. Governor Gavin Newsom, who I affectionately refer to as the Gav, he's seeking $1.4 billion for immediate COVID help. Governor Gavin Newsom is expected to ask the legislature to immediately approve $1.4 billion in his state budget proposal as an emergency response to the pandemic, primarily to produce access to vaccines and testing, and to support overwhelmed hospitals. Newsom will release his budget numbers today. And, you know, John, this story continues to remind me of the over $1 billion in 2 or 3 contracts that the Gav made last year, maybe 18 months ago, contracting for masks. And I don't know about you, but I still have not seen one damn mask. John.
You know, I actually think the state got its money back on those contracts, but I can check. I'm not really sure. Okay. Medicine meets emotion. COVID expert shares what happened when his son tested positive. The retweets, likes, and comments lit up for hours Saturday after a well-known SF COVID expert posted an extraordinary story on Twitter. I've been tweeting about COVID for nearly 2 years, wrote Dr. Bob Wachter, UCF's chief of medicine. But this week it became personal when my 28-year-old younger son got it. What followed in 25 tweets revealed a kind of wrestling match within Wachter, an internal contest between the data-savvy physician who knew that a young triple vaccinated person would probably weather COVID just fine, and as of Sunday, that appeared to be the case, and the loving father who felt the pandemic's pain up close, perhaps for the first time. With his son's permission, Wachter described his son as generally healthy, but overweight. Okay, I can't resist a comment here. How often on this show, when we talk about COVID, have you heard me talk about comorbidities and the fact that the people who get it overwhelmingly are people with comorbidities, of which obesity is probably the number one comorbidity? And again, it goes to the fact that Americans are sedentary and fat. And, you know, and so this guy grew up with a doctor as a father. I'm sure he never lacked for food and probably ate maybe more than his fair share. Wachter said his son works in customer service. In other words, a job where he sits in his ample rear in downtown San Francisco. He is careful. What does that mean? He masks up. Okay. So in other words, he does everything that a couch potato would do when he's being careful about the COVID protocols. But I still go back to the fact that, you know, we're talking about comorbidities here. The article goes on and talks, you know, and obviously he is affected by it. But, you know, to make this very personal, I have 2 sons, and one of them is not vaccinated. The other one is the other one's vaccinated with a booster. If either one of them gets it, I'm going to be upset. If my son who's not vaccinated gets it, he's a very intelligent guy. He's a West Point graduate, which, by the way, in the Forbes list of best universities in America is ranked number 11 in the entire country for academics. And he'll give you very cogent reasons as to why he doesn't want the vaccine, regardless. He's not vaccinated. So obviously, I'd say he's at higher risk than most people. And, you know, if he gets it, do I think that, you know, he's more or less been asking for it? Yeah, I mean, but I'm his dad. Would I still feel sympathy for the guy? Obviously. Would I still be concerned? Clearly. Would I still want him to recover? Obviously. But that's what happens when you're a parent. But it's interesting, and this story resonated with me because, as I say, I've got two boys, one of whom is vaccinated and the other of whom is not. So it can be interesting. Steve.
This involves healthcare workers with COVID can stay on the job. The state's Department of Public Health now says that healthcare workers who test positive for the virus can remain on the job at least through February 1 in order to keep hospitals functioning during the current surge. John, I don't get this at all. If you are diagnosed positive with COVID, what the hell are you doing staying on the job? You are supposed to go home. You are supposed to quarantine, and I don't get this story at all. But this is from the State Department of Public Health. John, am I coming out of left field or what?
No, but I think it goes back to, as the resident socialist on the program, you have heard me talk time and time again about how the nature of medical care in America is made precarious by the fact that it's all motivated by money. And when you're motivated by money, you operate on thin margins. That's why the supply line is creating problems for people. But with the supply line, that's just a matter of whether or not you get your toy on time. With hospital workers, it's a question of whether you get your health care at all, if on time. But when you have a healthcare system that's motivated the same way as Walmart in terms of profit margins and cutting it short, this is what happens. There's an interesting quote in one of these articles. I don't even know whether it's on the one you're reading now or what I last read, or maybe one that's coming up, where one of the nurses said, the hospital created this problem themselves. Rather than staff with permanent people, they decided to go for short-term solutions and hire temporary workers, which, by the way, they pay way more than the permanent workers, but it's a temporary solution. So there you have it. You've got a system that's operating on that financial basis, and this is one of the predictable side effects when something slightly goes off.
And John, I think you were just commenting on the story that I read. Is that correct?
I think so, yeah.
Okay, well, then you've got the next story, buddy.
And this one is overwhelmed by COVID surge. California City asks residents to limit 911 calls. Officials in San Francisco, yeah, that's a California city, are asking residents to limit 911 calls and hospital emergency room visits as the city grapples with a surge in COVID-19 cases. Calls to 911 dispatchers are averaging 400 a day, a 30% spike over the normal daily average of 300 to 330 calls, Fire Chief Janine Nicholson told KRON. Please don't call 911 to ask for a COVID-19 test or because you have a cold or minor flu symptoms, Nicholson told KNTV. We really want to keep our ambulances available for people having a heart attack or strokes. About 10% of the fire department's workforce, about 140 employees, are out with COVID-19 themselves, she told the Chronicle. The extra calls for non-emergencies are putting a strain on the system. Most COVID cases are mild and can be treated at home. Okay, again, I mean, this, what I find incredible about this, I mean, really, you call up 911 to ask where you can get a COVID test? I mean, I think this is a failure of public health information and public education. I mean, come on, people. I mean, you're supposed to understand that 911 is for a life or death medical emergency, not, where's my local drugstore and do they have a COVID test? You want to find that out? Call your local drugstore. I mean, really, are Americans so illiterate that they don't understand the difference between a life and death situation and a convenience? Well, apparently they are, because they're bombarding 911. And this is in San Francisco, where probably a majority of the people have an elementary ability to read and write. And I stress elementary. Steve.
And John was born in the Bay Area, so if anybody on this show would know, it wouldn't be me. From the Los Angeles Times, I'm sorry, let's do the break. You're dialed into Work Comp Matters, where we have stories of current events that are of interest to you, California employees, employers, and of course, we haven't forgotten about you damn independent contractors. We are, of course, sponsored by mancavepodcasting.com. We've got over 600 shows in the tank, completely free, no obligation. And if you want to do your own podcast, we will manage, produce, direct, stream that sucker live, and get it into the cloud forever. Next story from the Los Angeles Times. LA County sets new daily record. Los Angeles. Oh, I'm sorry, John. Go ahead.
I just want to point out, I wasn't born in the Bay Area. I was born in the middle of San Francisco. Go ahead.
Okay, John, thank you for that clarification. Whatever the hell that means.
The city itself.
I thought that is the Bay Area, the city, isn't it, John?
The Bay Area is a whole bunch of suburbs all around San Francisco. I mean, people say I'm from the Bay Area, and I ask them, where you're from? And they tell me, and I say, oh, yeah, when I was growing up, that was a day trip.
All right, very good. Los Angeles County reached another daily record of coronavirus cases as health officials yesterday reported more than 45,000 new infections. The county recorded 45,584 new cases amid the surge in infections driven by the highly contagious Omicron variant of the coronavirus, according to figures released by the county's Department of Public Health. The department also reported 13 new deaths, bringing the county's total number of deaths to 27,785 since the start of the COVID-19 pandemic. John.
Okay, I'm trying to find my next. Oh, here we go. This is from CBS News. COVID-19 symptoms and the Omicron variant, what the latest studies show. Doctors studying Omicron spread around the world have found new clues to the pattern of symptoms caused by highly mutated COVID-19 variant, which a growing number of reports suggest might show up differently and faster compared to the Delta variant it is now displacing. Early evidence suggests that in many patients, Omicron is leading to a new trend of milder symptoms that mostly affect the upper respiratory system. Does anyone know what the lower respiratory system is? Anyway. The nose, mouth, and throat. That is the lower respiratory, the lungs? I don't know. That may help explain why it appears to pose a smaller individual risk of hospitalization or severe disease than earlier strains of the virus, which often invaded the lungs. There you go. I guess that's the lower. What is becoming clearer is that Omicron seems to have lesser impact on lungs than prior variants, said Dr. Ronald Whelan, head of Discovery Health's COVID-19 task team. Whelan's employer, South Africa's largest health insurer, released an early report last month on the Omicron wave there. Their analysis found that a sore throat ranked among the most common early Omicron symptoms, as well as congestion, a dry cough, and lower back pain. That's interesting. The incubation period, the time from infection to symptoms appearing, was as short as 3 days. That's several days faster than the previous strains of the virus. Interesting, eh? Steve.
Oh, John, now I got it, John. And I was confused. We just, B helped me look it up. The upper respiratory system is the nose and the mouth. The lower respiratory system is the trachea and the lungs. I always thought upper respiratory was the lungs myself, but B just looked it up. And since this is her first day on the job, she wouldn't lie to me. I'll check back with you in a year to let you know what's happening. But
good job, B.
Good job, B. From the San Francisco gate, if you tested positive for COVID-19 or were exposed to them, you may be confused by the guidelines asking you to stay home. How many days do you need to stay home? Is it 5 or 10? Do you need a negative test to leave your house? Things are changing fast and it's confusing, especially in California, where guidelines don't line up exactly with those from the Centers for Disease Control and Prevention. As I said just a couple of minutes ago, they just said that if you got COVID and you're in the healthcare facility, you don't need to go home at all. Keep working. I don't get it. John.
Yeah, by the way, I would point out to you that sfgate.com is also the internet byline for the San Francisco Chronicle. Okay, think mild Omicron is no big deal? Here's what long COVID symptoms feel like. One of the things we keep hearing about Omicron, the new coronavirus variant of note that has propelled COVID-19 cases to record levels in the US, is that preliminary data shows it to cause milder disease, which implies a lower death rate. People seem cautiously optimistic, and considering the mass deaths from the Delta variant, this makes sense. The problem, though, is that mild disease just means you don't wind up in the hospital, and mild might not be the end of the story. People seem to think that COVID-19 is binary. You either die or you get better. You might even be lucky enough to get better after being asymptomatic. But there's actually a third path, which is long COVID. You don't die, but you don't get better either, and are left with debilitating symptoms that might be permanent. And no one is sounding the alarm about the risk of disability from mild cases of COVID. Long COVID is common following even mild cases of COVID-19, and its symptoms can be far more severe than the mild case it came from. It can lead to devastating illnesses with symptoms that wreak havoc on every part of your life, including a condition called capital ME/capital CFS, also called myalgic encephalomyelitis or chronic fatigue syndrome, a usually lifelong debilitating disability. I promise you don't want it. Okay, this article was written by, guess what? A woman who's got that condition. And guess what we call that condition? We call it a comorbidity. Now, in the case of chronic fatigue, there's plenty of medical dispute about what it really is, where it comes from, and who gets it. But whatever, it goes back to what I've been saying for a long, long time since this whole thing started, which is that if you have a comorbidity, you're certainly going to be at risk, regardless of what that comorbidity is. Steve.
Representative Young Kim, Republican from La Habra, announced in a tweet Saturday, January 8th, that she has tested positive for COVID-19. Kim, 59 years old, who represents parts of Orange, Los Angeles, and San Bernardino counties, said she was feeling fine and that she had received both vaccinations and a booster shot while she recovers. Kim said she will be proxy voting as I monitor my symptoms. John.
This is from the San Diego Union Trib. County warns of fake COVID-19 testing sites. I got to say this, there's always enterprising people anywhere who are going to take advantage of you. And apparently this is another opportunity. As lines grow ever longer at COVID-19 testing sites, county health officials are warning that some pop-up operations, I love that word, pop-up, may be unlicensed and out to scam people. San Diego County Chief Medical Officer Eric McDonald said he personally encountered an unlicensed testing station near the Old Town Transit Center and could quickly tell it was not legitimate. We've seen these pop-up occur somewhat near our county stations and other legitimate testing stations, he said. It's fairly easy to see they're not legitimate when you ask some very basic questions, like what test do you use? What laboratory are you sending it to? What is your healthcare credential to do this test? It usually requires a license to have a professional gather that kind of specimen. Now, I've got to make an observation. I mean, both Steve and I have had jillions of industrially injured clients. And let me ask you, Steve, because I know the answer on my end. How many times have you asked those clients, do you know what the medication is for? And what is the answer they give you?
At a deposition, they're always asked, and the answer most of the time is, I don't know.
Exactly right. So my point is, this guy here is saying, well, if you ask these probing questions, you're going to find out they're fake. Well, guess what? That's not in the nature of people. People think that if somebody's presenting themselves as a medical health professional, they're going to do what's good for you, whether it is or isn't, and even whether or not it's fake. So the problem with asking those kinds of specific questions is that most people don't do it, even when they get prescribed medication, which they take, in many instances, take one or multiple times a day. I mean, you're damn right. I'd want to know, doc, what does this do for me? I'd at least Google it to find out, what's this thing supposed to do? And decide on my own whether the doctor is, wrong or whether he's right. You can make it's your body, make that determination for yourself. But anyway, I think it's interesting. And again, it's amazing to me because I live in Munich, and you can get a COVID. I mean, there's a COVID testing place on I won't say every street corner because that's an exaggeration, but pretty close. I mean, there's a big COVID testing center in the right near the big shopping center I go to almost every day, which is like a kilometer from here, like a mile, a little less than a mile from here. There's another one that might be just as close and another big transit point. That is a pop-up station. And the quick tests in Munich are all free and they're available all over the place. So it boggles my mind that the United States is having all these problems providing testing to people when it's still the richest, if not the richest, certainly one of the richest countries on earth. Steve.
Yeah, John, hang on really quick. John, everyone knows that doctors and nurses are burned out from COVID-19, facing staffing shortages, full emergency rooms, and COVID exposures. But one group of healthcare workers have been overlooked and face its own set of COVID-related difficulties: pharmacists and pharmacy technicians. Most pharmacists who've been in the field for a while have been telling students, just stop, don't go to pharmacy school. Do something, do something else, anything else. One clinical pharmacist in Boston said, I'm hoping that the people who are going into pharmacy school are doing it because they truly have a passion for it and will fight for it and want to do nothing else with their lives. So, John, at the start of the show, we said everybody last year either went on strike or threatened to go on strike except doctors. And obviously, pharmacists and pharmacy techs are no exceptions. John, I think we're ready for your last story.
Okay, this is from ABC News. The government is sending free rapid tests. That's the first part of the sentence. There's a comma. But don't expect them all before Omicron's peak. Isn't that nice? The Biden administration's plan to send 500 million at-home tests to Americans for free is an historic undertaking, but one that will take weeks or months to fully execute. Recently released contracts and interviews with 7 test manufacturers suggest. Contracts for the first 2 batches of tests were announced on Friday, one for 13.3 million kits from a health technology company and another for an undisclosed amount. Yeah, why would we want to know that, right? From a distribution company in Virginia that had extras on hand, all to be distributed in an effort to reduce the massive testing shortage in the United States. And while a White House official told ABC News that the rest of the contracts to fulfill the 500 million pledge are expected to be awarded in the next 2 weeks, the cumbersome process of ramping up test availability indicates that the plan won't deliver a quick fix. Tests won't be available to be ordered through a government website until later this month, meaning it's unlikely the average American will get free tests delivered in time for the January peak of Omicron cases predicted by most models. So once again, we are stuck with the fact that America has a health system that just operates on the edge. And when that edge gets pushed, this is what happens, folks. Steve.
All right, John, and thank you very much. And any closing thoughts, burning desires, buddy?
No, not really. My younger son keeps telling me, Dad, you've been on the planet for that long. How can you continually be surprised at all these things? He raises a good point. Maybe I'm not as cynical as I thought. I don't know.
I don't know, but we will see. Anyways, I want to thank everybody for tuning into this edition of Work Comp Matters. Much thanks to Scott Walton of legendary Uncle Studio, John Scalia out in Munich, Germany, and of course, mancavepodcasting.com. If you want to do your own show, we'll produce, direct, manage, get it streamed live. And if you want access completely free, no obligation, to 600 Podcast, mancavepodcasting.com. That's it. We're done. We'll see you live Friday, 12 noon for another edition of Work Comp Matters. Bye, everybody.